I'd like to discuss the nutrition of the intervertebral disc and its implication with disc degeneration. I started my research in this in 1966, and it involved reading of a 2-volume text called The Biology of the Intervertebral Disc by Peter Ghosh. Peter Ghosh is an associate professor of surgery and a researcher at the Raymond Purvis Research Labs at the North Shore Royal Hospital of Sydney, Australia. He wrote in this book, very briefly, this comment: the nucleus pulposus of a highly hydrated gel of proteoglycans containing some collagen. In children and adults, the water content of the disc is 80%. This high water content arises because of the composition of the nucleus containing proteoglycans known as sulfated glycosaminoglycan side chains. Because of the negative charge sulfate with these proteoglycans causes the nucleus to imbibe fluids and create the turgor of the disc. So I started reading this 2-volume set and became most interested in the study of the intervertebral disc. Since 1966, I've studied the nutrition based upon learned people like this, and I've developed a formula called Discat Plus Enhanced. This is chondroitin sulfate, glycosaminoglycan, glucosamine sulfate, the trace minerals found in the disc tied to the sulfate radical that creates a Donan equilibrium to draw fluids into the disc through the end plate. I'd like to cite some research as to the importance of the nutrition of the disc. At the outset, this is a research documented 82 referenced booklet that you can use or give to your patients, citing many more papers that I'm going to share here. It shows the benefits of stopping disc degeneration and perhaps regenerating discs. I don't claim to have the final answer to this, just sharing the most recent research that I know of for your consideration clinically in treating the nutrition of the disc. Let me cite some papers for you. Number one, Bishani wrote in 2016 in a journal that chondroitin sulfate is approved in the United States as a treatment of osteoarthritis. Raddick wrote in 2015 there is a deficiency of chondroitin sulfate leading to disc degeneration. Yang wrote in 2016 that chondroitin sulfate inhibits the metalloproteinases that break down disc. Singh wrote in 2015, pain relief better than placebo with chondroitin sulfate. Tat, 2010, chondroitin sulfate inhibits interleukin 6, interleukin 1b, and prostaglandin E2, the chemical cytokines that lead to not only degenerative disc disease, but chemical inflammation of the dorsal root ganglion and nerve roots at the disc level. Ubelhart wrote in 2008, chondroitin sulfate is safe for symptomatic relief of osteoarthritis. Volpe wrote in 2004, chondroitin sulfate reverses, retards, and stabilizes osteoarthritis pathology. Moriali wrote in 1996 that chondroitin sulfate is longer acting pain relief than NSAID drugs. Zaifeng wrote in 2003 that chondroitin sulfate in the central nervous system regulates neurite formation, synaptic plasticity, increases neuron survival, and breaks up cell adhesions. Koike wrote in 2015, chondroitin sulfate adds as an alternative treatment for osteoporosis. Pumeister wrote in 2015 that chondroitin sulfate inhibits dorsal root ganglion growth of neurons into the intervertebral disc. This is a big problem in discogenic pain. Is it under inflammation, degeneration of the disc, new nerves grow into the DRG? Chondroitin sulfate inhibits that. Cantor wrote in 2013 The chondroitin sulfate and glucosamine sulfate show 45% lower incidence of colorectal cancer incidence from non-users. Something you've probably never been aware of, but all of these references are here for you to read. From the journal that they are taken from, you can read in order to know that these are factually peer-reviewed references. Satya wrote in 2009 that there is a lower incidence of colorectal cancer in people who take chondroitin sulfate. In 2009, Satya wrote not only lower colorectal cancer, but the incidence of lung cancer dropped a hazard ratio of 0.74 and 0.72 for lung and colorectal cancer. Brodsky wrote in 2011 that glucosamine sulfate reduces lung cancer adenocarcinoma by a hazard ratio of 0.49. Cantor wrote in 2014, chondroitin sulfate lowers high sensitivity C-reactive protein by 36% and lowers prostaglandin E2 by 27%. Navarro wrote in 2015 that glucosamine and chondroitin sulfate lower systemic inflammation and degenerative disc disease in patients. Bell wrote in 2012 that glucosamine sulfate lowered the risk of cancer and respiratory disease, and also that chondroitin sulfate and glucosamine sulfate combined reduced mortality. Now, with these thoughts in mind, on published research, I have been using Discat for relieving pain because of its anti-inflammatory and hopefully stopping disc degeneration since 1966. I have developed and studied that the highest source of chondroitin sulfate on Earth is the green-lipped mussel, perna canaliculus, grown by cables hanging in the ocean in Australia and New Zealand. They are the highest source of chondroitin known. It has definite anti-inflammatory properties, also used, according to this reference by Stephen Daniels, that chronic inflammation has been linked to a range of conditions linked to heart disease, osteoporosis, cognitive decline in Alzheimer's disease, and type 2 diabetes. Remember that if you have an inflammation of one part of the body, it can create pain in other parts of the body that also are under some pathological degenerative change. For example, you develop low back pain, your shoulder pain increases because of the increase in the inflammatory cytokines floating in the serum, which not just affect the parts that you feel pain, but the potential pain generation in other areas of the body. So we created this formulation that today delivers the best anti-inflammatory, degenerative reducing, and pain relieving results that I know of in existence today. This is modified as new research comes out. This formula just came out. The goal of it is to be anti-inflammatory and to control pain. Glucosamine and chondroitin are anti-inflammatory. Therefore, Discat Plus Enhanced is the newest formulation that I have produced, re-engineered to gain the current research, the best ability for anti-inflammatory change, and pain control. It is perna canaliculus. The formulation of this, when we treat acute back pain, for the first 3 months, patients will take 3 capsules twice a day. At the end of 3 months, we reduce that dosage by 50% to taking 3 capsules per day only, giving our patient 600 milligrams of chondroitin sulfate and 750 milligrams of glucosamine sulfate. This is the dosage that we use in treating inflammatory degenerative disc disease in the low back. This is the formula, Discat Enhanced, that I urge you to study. Please know that we are following the research. I collect the research on a daily basis in order to be able to improve the formula for our patient care. Thank you.